All right, let's dive right in. Today, we're going to talk about a topic that gets thrown around a lot, but is often deeply misunderstood: obsessive compulsive disorder, or OCD. Together, you and I are going to peel back the layers, get past the stereotypes, and really understand the science and the clear path toward getting better.
So when you hear those three letters, OCD, what's the first image that pops into your head? For a lot of people, it's someone who just loves to clean, or maybe someone whose desk is perfectly organized. But is that really what it's all about? Well, spoiler alert, not even close. That's a huge misconception, and we're about to unpack the much more complex reality behind the label.
Yeah, to truly get it, we've got to look way beyond just being tidy. OCD is a really challenging condition that's built on two core parts. And these two parts feed into each other, creating this debilitating loop for the people who are stuck in it. At the very heart of OCD are these two things: obsessions and compulsions. Now, obsessions, these aren't your everyday worries. Nope. These are thoughts, images, or urges that just barge into your mind totally unwanted, and they crank up your anxiety to an 11. So what do you do to fight that feeling? That's where compulsions come in. These are repetitive things you feel you have to do, either physically or in your head, to try and get that anxiety down or stop something bad from happening. This right here, this sums it up perfectly. It's a cause and effect relationship. The obsession is like a spark that starts this massive bonfire of anxiety. And the compulsion, that's you frantically throwing water on it, just trying to put out the flames. But, and this is so important, the relief you get, it never lasts. And here's where it gets really tricky. You see the cycle? It is a trap. An obsessive thought pops in your head, anxiety skyrockets, so you do the compulsion, right? And for a split second, whew, you feel better. But here's the kicker. That little moment of relief actually teaches your brain the wrong lesson. It says, see, that ritual worked. So the next time, the obsession comes back even stronger. It's a cycle that just keeps feeding itself, getting tighter with every loop. Now, if you want to understand the deep suffering that comes with OCD, you have to get this term ego dystonic. It's a fancy word, but the idea is pretty simple. It means these obsessions feel, well, foreign, like they're not yours. They are alien invaders that go against everything you believe in, everything you value. And that's exactly what makes them so terrifying. It feels like your own mind has been hijacked by something that isn't you. Okay, so we've got the how, the mechanism of the cycle. But what does OCD actually look like in the real world? Well, it's not just one thing. It actually shows up in a whole bunch of different ways, different flavors, if you will, that researchers call symptom dimensions. So, researchers have pretty much grouped them into 5 main categories. First, you've got the one everybody thinks of: fear of contamination, with all the cleaning and washing compulsions. Second, there are fears about harm or doubt, which leads to all those checking rituals. Third, there's this intense need for things to be just right, symmetrical, perfectly ordered. Fourth is hoarding, which today is often considered its own separate thing, but it's related. And finally, and maybe the one that's hardest to talk about, are taboo thoughts, really disturbing, unwanted thoughts about aggression or sex or religion that are, you guessed it, deeply ego dystonic. And if you look at the numbers, a clear pattern emerges. Even with all those different types, the number one most reported obsession is contamination. Fear of germs, dirt, illness, you name it. And the most common compulsion? Checking. Did I lock the door? Is the stove off? Let me reread that email one more time. It's all about that desperate search for certainty. So that's the what. Now let's get to the why. What is actually happening inside the brain to get it stuck in this painful loop? Well, this is where modern neuroscience gives us some absolutely fascinating clues. But before we pop the hood and look at the brain wiring, let's just pause on this number, 2 to 3%. Now, that might not sound like a huge number, but think about it. That's about 1 in every 40 people. You almost certainly know someone who has struggled with this. This isn't some rare, obscure condition. It's a major public health issue. Okay, here is the absolute best analogy for what's going on. I love this one. Imagine your brain has this built-in error detection system, kind of like a smoke alarm. Its job is to go off when there's a real danger, right? A real fire. Well, in OCD, that smoke alarm is defective. It's way too sensitive. So you burn the toast just a little bit, and instead of a small beep, the alarm starts blaring at full volume, like the whole house is about to go up in flames. In the compulsion, That's you, running around in a panic, frantically waving a towel at the alarm, just trying to make it stop.
So that faulty alarm isn't just an analogy, it's a real thing in the brain. Neuroscientists call it the CSTC loop. Don't worry about the name, just know it's a critical circuit that's supposed to handle something is wrong messages. Brain imaging shows that in people with OCD, this whole network is basically an overdrive. A little warning signal gets sent, but instead of being filtered out and dismissed, it just gets stuck, echoing over and over and over again. And what's the chemical messenger that's mixed up in all this? Well, a mountain of evidence points to serotonin. You've heard of it, right? It's a key neurotransmitter. The leading theory is that when your serotonin system isn't regulated properly, it contributes to the stickiness of those signals in that faulty alarm circuit, making it easier for them to get stuck on repeat.
Okay, so that's the problem. But here is the most important part of this whole story. This is a solvable problem. We now have incredibly effective ways to break the cycle. We know how to recalibrate that faulty alarm. So the question is, how do we do it?
It really comes down to two gold standard approaches that are backed by tons of evidence. On one side, you have a very specific, very powerful type of therapy. And on the other, you have medications that directly target that brain chemistry we were just talking about. And very often, the most powerful strategy is using them both together.
The absolute powerhouse of OCD therapy is called exposure and response prevention, or ERP. Let's go back to our smoke alarm. Exposure is when you, on purpose, let the toast burn just a little bit to trigger the alarm. And then, and this is the really hard but crucial part, response prevention means you resist the urge to do the compulsion. You don't wave the towel at the detector. You just stand there and let it blare, and you learn, through experience, that the anxiety will eventually go down on its own. You're retraining your brain to realize it's a false alarm. Then we have medication. These are typically serotonin reuptake inhibitors, or SRIs. Now, their job is not to silence the alarm, but think of it more like turning down the volume knob on that overly sensitive system. By helping to regulate serotonin, they make the obsessive thoughts feel less intense and the urges feel less powerful. And of course, that makes it a whole lot easier to do the hard work of ERP and finally break that cycle for good. All right, finally, we have to clear up some really common mix-ups. OCD gets confused with a couple of other conditions all the time, particularly obsessive compulsive personality disorder, or OCPD, and hoarding disorder. And believe me, knowing the difference is key. Let's just put them side by side to make it super clear. With OCD, we've got those distressing, feel like an invader obsessions, ego dystonic. Now, OCPD is totally different. It's a personality disorder. This is a person with a rigid need for perfectionism and control, but they see these traits as a normal, maybe even a desirable part of who they are. And hoarding disorder is specifically about that persistent difficulty getting rid of things, which leads to so much clutter it gets in the way of life. So if you walk away with one thing, let it be this. It all comes back to that word, ego dystonic. For OCD, the thoughts feel wrong, like they are an invasion. But for OCPD, and often for hoarding, the traits are ego syntonic. They feel consistent with your identity. The person with OCPD isn't tortured by their need for order. They think it's the right way to be. That is the absolute core distinction. All right, let's lock all this in. Your memory anchors. Number 1, OCD is a cycle of obsessions causing anxiety and compulsions bringing only temporary relief. Number 2, the thoughts are ego dystonic. They feel alien and wrong. Number 3, it's all connected to that hyperactive, faulty alarm circuit in the brain. And number 4, and this is the most important one, there's a way out. We can retrain the alarm with ERP therapy and turn down its volume with SRI medications. And I just want to leave you with this final thought. The fact that a treatment like ERP is so successful is a powerful, powerful demonstration of neuroplasticity, the brain's amazing ability to rewire itself. It proves that even when a circuit is well and truly stuck in a powerful, distressing loop, it is possible to teach it a new way, to carve out a new path. And that is just a profound message of hope, not just for OCD, but for understanding our own incredible capacity for change. Thanks for watching.